Hello there, it's Dr. Patricia Coughlin again, wanting to follow up on my last video about superego pathology and more specifically, as someone wrote to me, how superego pathology can create and maintain depressive symptoms. The person who contacted me has a patient who has been chronically depressed and whose defenses of self attack are very syntonic. So this patient is saying, yeah, I don't expect to get better, and so on. So, how do we understand this? And then, how do we deal with it? Right? And you really have to look at that first question, right, before jumping to the second, right? I can't just give you some pat answer about how to deal with these kinds of defenses that obviously will become a resistance. If the patient needs to hold on to their suffering, right, they're going to undermine all your efforts. So again, we have to understand, why would that be the case? As Goethe said long ago, the addiction to suffering is the hardest to break. Now, why is that? Right? So, is there secondary gain that someone gets out of being a victim and sort of a sad sack? Are they identified with a depressed parent, and staying in that state somehow maintains the bond? Or again, are there wishes and maybe even behaviors that the person has engaged in that has a heavy load of guilt associated with it? And rather than really feeling that guilt and taking responsibility to do something about it, they wallow in self-punishment. I'm thinking of a case I've been treating recently where, it seems like there's a great deal of self-punishment in operation. And of course, I'm trying to find out, why is that first before I know how to deal with it. And I just said, good heavens, I mean, what did you ever do to incur this kind of, life sentence, really, life sentence of suffering? And he said, oh, well, I've done a lot of things, actually. So this man had quite a history of using and abusing other people, and again felt a tremendous amount of guilt about that. So we really had to go back and look at these incidents, what he had actually done to hurt other people, and to recognize that his guilt was connected to love and concern, and how he could shift from punishing himself, which doesn't help anybody, right, to making some kind of repair attempt and to turn his life around. And of course, this was particularly difficult because many of the people he had hurt are already gone. They're dead. He can't actually do something there, but how can he sort of, in their honor and in their memory, turn his life around and begin to contribute in a way that has meaning? So, again, the point that I'm really making is that if a patient is saying to you, look, I'm a hopeless case, I don't expect to get better. I mean, the obvious question is, what are they doing there then? I mean, if that's actually the case, they wouldn't be seeking therapy, right? So, that you have to begin to explore that, and whether they're also getting some kind of pleasure actually out of undermining you, right? So I'm thinking of another case where this woman seemed to block me at every turn. And originally I was thinking this was just her character defense, but it turns out that it was actually a manifestation of anger that she had toward me and toward who I represented, and that came out in sort of this stubborn defiance, and I'll be damned if I'm going to let you be successful with me. Okay, so again, it's just essential to explore this so that you can get to the meaning and significance. What is actually driving this need to hold on to suffering and to obstruct the therapeutic process? So again, I wish I could just have a single simple answer for you, but life is complex and messy. It's also interesting. So really explore this with your patients and make it quite explicit, right? Including the fact that, if they've already decided you're not going to be helpful to them, then there's no reason for you to meet. I mean, this is the essence of Davinlou's head-on collision, which is really a collision with reality, right? The reality is, if the patient has decided they're a lost cause and that no one's going to help them, that's the reality. So in making that explicit, right, they might be able to start to turn on that. But unless and until they do, you don't really have a therapeutic alliance. And without that, nothing is going to happen. So you have to ask yourself why you would continue to see such a person. Because in doing so, you're actually creating a collusive alliance, right? You're colluding with their defenses, pretending that you're doing something therapeutic when you're not. So sometimes really the most compassionate, the most authentic thing to do is to say we have no basis here for working together, and that you're not going to continue to take someone's money when they have no intention of being available to the treatment. So I hope this is helpful to you. I'm sure some of these ideas are provocative or upsetting. Just, contact me, let me know what you're thinking, what you're curious about, and what your experience has been with patients who really have a very syntonic need to suffer, and a strange kind of comfort with that they're really not terribly willing to give up. Okay, until next time, bye-bye.